this up. Okay? Right? Now, leukopoiesis, Leukopoiesis, right? That means making of what? Leuko means what? White. White blood cells, right? Making of white blood cells. Yes? Okay. Now, the opposite of that is leukopenia. P-E-N-I-A, right? Yes? Let me ask you something. Leuko means white. Okay, this is a tough one, but you're going to get it this time, young lady, okay? Is a penny very much money? No, if all you got is pennies, you're poor, right? Leukopenia means way low white blood cells. Low WBC count. Okay? Leukopenia, right? The same with the bones. Osteopenia, right? Osteopenia, before you get osteoporosis, your bones aren't very strong. Penia means poor, right? And I always remember a penny is not very much money. That's how I remember that one. But anyway, okay? Leukopenia, abnormally low white blood cell. What usually causes your white blood cells to be way low? Chemo drugs. That's usually what it causes it, right? Usually chemo drugs, but it can be, remember we talked about the adrenals and we talked about the mineralocorticoids, and the next one is the glucocorticoids, and the main one is cortisol, right? If it's way low, then you can have low white count, okay? Right? Yes? Okay. Leukemia, L-E-U-K-E-M-I-A, leukemia, right? Now, leukemia, right? White blood cell overproduction or abnormal white blood cells, right? There are a bunch of types of leukemia, yes? Now, leukemia it used to be a death sentence, and now they are amazing. The medical folks can do with a lot of leukemias, they can keep it under control or get rid of it. I've had several patients over the years, men that came down with leukemia, and they went through the treatment, and it took about 18 months, and several of them lost all their hair, and then it grew back, and it's a miracle. And 10, 15 years later, back 4th of July, I was at a dinner, and a gentleman, that happened to him. And you know what he said? Years ago, he told me, he said, well, he said, it's about a 1 in 100,000. He said, I won the lottery, but I won the bad lottery. Got leukemia. But anyway, leukemia. Too many are abnormally white blood cells, okay? Now, what are the symptoms? You have fever, especially weight loss, right? And you can have bone pain, right? Oh, by the way, where do they check you when they do a bone marrow? Dang it, the word won't come to me. When they check your bone marrow, right? They do a biopsy. Where do they stick the needle? Pardon me? Epiphyseal plate? No, that's a good guess. No, right here, right there on the hip, right? Yes, because we said that we make our blood cells, especially in the flat bones of the pelvis and the upper part of the humerus and the upper part of the femur. So usually they stick a needle right down here on your pelvic bone, right? And that's where they get a sample from, okay? Okay, now let's talk about infectious, I-N-F-E-C-T-I-O-U, infectious mononucleosis, right? Infectious mononucleosis, right? This is viral, right? You have all those lymphocytes, right? It's caused by the Epstein-Barr virus. Yes. Okay. And you'll have excessive agranulocytes. By the way, When you had this, Miss Dawn, what did they tell you? Oh, Dawn, you got this disease. You got that, right? What's it called? You had it in junior high. I know.
I really don't know.
Mono.
Oh, mono.
What's the other name for mono? The what disease?
Oh, kissing.
There you go, right? Right? Yes? Infectious mononucleosis, the kissing disease, right? Your agranulocytes, your lymphocytes, way high. And what are the symptoms? You get a bad fever, you feel like crap, you're tired, you run down, and the sore throat won't go away. I said a fever, not a high fever. You get a low-grade fever, and you got a bad sore throat, and it lasts for like a couple of weeks. It just won't go away and such. And if they check your blood and your agranulocytes, your lymphocytes are way high, the monocytes, right? Hence mononucleosis, right? The kissing disease. Yes. Thanks for being a good sport. I was just kidding with you. Always the cute girls. Yes. They're the ones that get that. Yes. Right? Okay. Tired, achy, chronic sore throat, and a low-grade fever. What's the treatment? Pardon me? Okay, it's a virus. So the treatment is stay home, eat lots of chicken soup, and rest, and it takes a couple weeks to go away, and they'll probably have to go to school and get your homework and bring it home to you for you to do at home. That's very common, right? Many kids that I went to school with had this, right? Yes. Not Dr. Weld. No, no, none. Yes. Right? Yes. Man, oh man. Okay, let's talk about platelets. Platelets. Platelets, aka thrombocytes. Thrombocytes, right? The thrombocytes, the platelets, right? We already talked about platelets plug the hole. If I get a cut, platelets are going to show up, right? And they got calcium granules in them. And what's going to happen is that's going to induce me to blood clotting, right? The fibrin is going to activate the fibrin, and the fibrin's a protein like this. I think of it as like chicken wire or string, and the platelets are going to stick, and it's going to plug the hole, right? Platelets, okay? Now, normally you're going to have about 150,000 to 400,000 thrombocytes or platelets, yes. Okay. Now, if your blood levels go below 50,000, below 50K, that's called thrombocytopenia. Thrombocytopenia, right? Thrombocytes, what does penia mean? It means you're poor. All you got is pennies. You don't have enough thrombocytes, right? Thrombocytopenia. Okay? And so, what is older people get thrombocytopenia? And what happens is they get tiny little, it's called petechiae, tiny little bruises on their arms, right? Yes? And their blood won't clot properly. Oh, by the way, yes? Microhemorrhages, M-I-C-R-O, micro, H-E-M. P-E-T-E-C-H-I-A, petechiae, okay? Right? Little bitty broken blood vessels, you get the little bitty bruises called petechiae, okay? But they're micro little bitty hemorrhages, right? Okay, small purple spots on the skin. Under 50,000, we talked about that. What's the most common cause of this, by the way? Anybody want to guess? You had a patient who had this and thrombocytopenia. And so she got the bloody nose. Blood started bleeding. Could not stop it, had to go to the ER. They stuffed the balloon up there, blew up the balloon to squeeze on it, this and that, and finally, after about 2 days, got it to stop bleeding, okay? She didn't have enough thrombocytes, right? thrombocytes plug the hole, platelets plug the hole, right? What's the most common cause? Chemo drugs, right? Years early, she had a cancer, breast cancer, and they gave her the chemo drugs. And she asked her chemo doctor, hey, how come I have this? Could this be because the drugs that you gave me to get rid of my cancer? And she said, the doctor ducked his head and said, yes. Right? Right? But he saved her life. But it was a pain. She died last year. Real sad. Real sad. Nice lady. I still know her daughter. I still treat her daughter. But anyway, right? Thrombocytopenia. Most commonly from the chemo drugs. But anyway, older people can get this too. Tiny little on their arms especially. You'll note that. On the trunk too, but especially the arms, you'll see that, right? Thrombocytopenia, not enough platelets, okay? Right, because those chemo drugs suppress your immune system. They suppress your blood making, okay? Okay, hemophilia, that's the people that they're several hereditary diseases, and they're associated with the people, more associated with the people in Europe, the aristocrats that inbred and their blood doesn't clot, right? Especially the Romanovs, right? The Russians, right? The Romanov family and the czars of Russia. One of their little boys died, and they had people around him all the time to make sure he didn't hurt himself or bump himself or cut himself, because he bled and bled and bled when he did, and such, such. Now, it also can be too if you got radiation poisoning, if you got radiation or something like that, and such, radiation exposure, but more commonly it's hereditary, it's passed down because of inbreeding. The royal families, they you know, if among the aristocrat, the kings and queens of England, they all, right, and they married cousins and all that stuff very closely, right? Yes. And so anyway, yeah, hemophilia, yes. Okay. Years ago it was a death sentence. Now it's not. So thankfully. Now, two, there are some other blood diseases. There are a bunch of blood factors. Factor number 8, factor number 9 associated with the hemophilia, and there's one called von Willebrand, and one von Willebrand factor, it had to do partly with COVID too, and that's part of the reason that Black people have less of that, I believe, and so they had more trouble with COVID. More Black people died of COVID than others, and such. Anyway, okay? Hemostasis, right? How to stop bleeding, right? There's a picture. My book, it's page 567. Basically, if you cut yourself, the first thing you get is a vascular spasm. Right? Blood vessels are made out of smooth muscle, and that smooth muscle contracts to make the hole smaller, right? And number 2, you get the platelet plug, right? Platelet plug. Yes. And number 3, you'll get coagulation. Coagulation. Coagulation means blood clotting, of course, right? Yes. And then when that thing heals up, the fibrin that we talked about, the mesh-like material that the platelets are stuck in, right? Yes. You'll get fibrinolysis, and it will break it down, basically. Your body will. Yes. Fibrinolysis removes unneeded clots in the blood vessels when healing has occurred. Yes. Okay. Now let's go back to a previous chapter, right? Cerebrovascular accident. Yes. CVA, stroke, right? Yes. Remember? One is called ischemic stroke, ischemia, ISCHEMIA, right? Blood vessel or clot. Yes. And the other one is called hemorrhagic, right? Burst, blood spurting out, yes, right? Usually in the brain. Okay. So remember, if you have An ischemic stroke, if they think you're having a stroke, they're going to do a CT scan right quick to see which type of stroke. Because if you have this ischemic stroke, ischemia means lack of blood. You're not getting enough blood to your brain, right? Then they will give you that TPA, tissue plasminogen activator, TPA, I believe it's called, right? And that will dissolve this clot, and you'll get blood flow, and you'll have very little sequelae to having a stroke, right? You'll probably have very few symptoms long lasting, right? But oh, by the way, we talked about that. If you wait more than 3 or 4 hours, it's too late. They can't give you the TPA. They can't dissolve the clot. And you may not be able to walk for the rest of your life. Or you may have the drawn up arm or the drawn up leg like that. When, if you would have gone to the hospital quickly, that all could have been prevented, see? And of course, too, if you're having a hemorrhagic stroke, maybe you got a blood vessel in your brain that blew or an aneurysm, right? They can do a surgery on that, but they cannot. And stop the bleeding, but they cannot give you the TPA. If they give you the TPA, they do what to you? They kill you, right? That's what happens if they give you the wrong stuff. That's why they got to do the CT scan first to know what the proper treatment is, right? Because TPA is amazing, but if you give it to the wrong patient, you kill them. No way, no. Bad. Very bad. Okay? Okay. Here we go. Let's talk a little bit about that thrombus formation. Okay? Thrombus formation. Right? Okay. Here's a blood vessel. You get a buildup. You get a buildup in that blood vessel, right? Yes? Okay. That's called a thrombus. Yes? Now, if part of that breaks off, you have a little clot floating around. That is called an embolus. E-M-B-O-L-U-S. Embolus. Right? Yes? Floating around. Oh, by the way, if you have a bunch of these, which are common, those are called, plural of embolus is emboli. Emboli. Right? Yes? Oh, by the way, if one of them blocks the whole blood vessel, right? That's an embolism. Embolism, right? Yes? An embolism. Okay? Again, little by little this builds up. If a piece breaks off, it's an embolus. But commonly, it won't be one piece, it'll be multiple pieces. Emboli, right? But an embolism, actually those are used interchangeably a lot of times in the hospital. Oh, they threw a clot, they got an embolism and such. But anyway, embolism, right? And whatever's downstream, right? If this happens in your heart, what do you have? Heart attack. If it happens in your brain, what do you have? Stroke, right? If it happens in your lung, what do you have? Can't breathe. Huh? Pulmonary embolism, right? Yes? Pulmonary embolism, yes? You're fine, and then all of a sudden, can't breathe, sharp shooting pains, right? I have a good friend that had to his wife last year, right? Oh, by the way, those pulmonary embolisms, especially after abdominal surgery, they got to really watch for that, okay? But anyway, okay? And such. Oh, by the way, you can get them in your calf, right? My calf's real sore. Golly, that mountain was 7 miles up, 7 miles down, 4,500 feet. Man, my calves are sore. But anyway, you get a deep vein thrombosis, right? Yes? Okay. Hey, somebody got shorts on besides me? Yes? Joseph, could you come up here and sit right here? with your legs over there.
This way?
Yeah, just with the legs sticking that way. Just sit on the table for me. Okay? Yes.
Legs sticking this way?
Yeah, that'd be fine. Yeah. Okay. Now, right? This big old manly man with the muscular calves, right? If I'm worried about thrombosis, I'm going to do this. I'm going to do this. Well, I'm going to do it this leg, right? I'm going to pull it up, which stretches that calf. And if he's got a thrombosis, it's going to hurt. Or I'm going to do this and squeeze it, right? And if he's got a deep vein thrombosis, it's going to hurt. Or if it gets red and swollen and hurts and it feels warm to the touch, right? Deep vein thrombosis, right? Associated with two, very controversial. You know, I have some stockings that go from here to here, right? And they're compression stockings that squeeze, yes? I spent like, I don't know, 20 hours on an airplane going to China. Oh my God, thank you very much, right? That one where you squeeze on the calf is called Holman's sign, I believe. But anyway, that's what you do. That's what I do. I had a lady in my office last week, and I'm pulling that toes up, and she's complaining of real bad knee pain and this and that. And I'm like, okay, does she have a deep vein thrombosis? And I'm pulling it up, and I'm squeezing on it. And if she does, then of course I'm referring her because I don't treat that, right? Send her to the ER. But anyway, right? And they give them moist complex compresses and give them some blood thinners and this and that. Hopefully it's going to calm down. But back to the airplane. You sit on an airplane like that for 6, 8, 10, 12, 14 hours and you don't have to get up and move around. I always, every 2 hours, get up and walk from the front of the plane to the back of the plane and back. Anytime I'm going on a very long flight. And always go to the bathroom, and people are like, oh, he's got a prostate problem. Well, that too, but anyway. But it's because I don't want a deep vein thrombosis. I don't have time for that, right? And again, sometimes the runners wear them. I have some of those. They go from here to here. You pull it up and it squeezes the blood back, right? Because remember, the muscular pump. By walking, my muscle contracting is a muscular pump, and it pumps that blood back to the heart, right? But if I'm sitting there not moving, yes, then what happens is I sit there for 10, 12 hours, I could get a blood clot, yes. Now, some studies say no, that's not true. Some studies say yes, it is true. So go figure, whatever, right? But anyway, if I'm on a big long flight, I'm taking those stockings and I'm wearing them because I don't have time to have problems like that. And I always get up and walk around and move around. I always do because, yes. And here's another tip too, right? If you pay about 150 more bucks, you get about 6 more inches of leg room. And if you're as tall as I am, pay it. Trust me, pay it, right? Yes. My wife told me last week, oh yeah, I upgraded. When we go to Scotland, I upgraded. Oh, thank you. Because I'm so tall, right? But anyway, yeah, no. It's, so you can move around and such. Yes, because if you've ever been on one of those 747s and there's like 400 people on it and you're like this, and I'm so tall my knees are touching the seat in front of me, you know, right? Anyway, yes. Okay, anticoagulant drugs, right? Anticoagulant, right? Blood thinning, right? Drugs, yes, okay. Most common one, aspirin. If you take a bunch of aspirin, it'll thin your blood, right? Now, not in Europe, but here in America, they still commonly give people, and they say take a baby aspirin every other day or every day. It's very common. They don't do it in Europe. They just still do it here. They're much more conservative in Europe than they are here, okay? But anyway, I think there's very limited value to that. But I'm not a cardiologist, right? But I've done some research on that. Yes? Number 2, heparin. Heparin's what they flush your IV tubing with. They give it to you before surgery. They don't want you to have a blood clot after surgery, right? Especially if they're doing surgery on your abdomen. They don't want you to have pulmonary embolism, which you can die from, right? And oh, by the way, it's very common they give you Coumadin, Coumadin. Coumadin, aka warfarin. Coumadin or warfarin. By the way, what is that? Coumadin or warfarin? What is it? You can go down to A to Z and buy it. right? Yes? It's rat poison. That's what it is, coumadin. And what does it do? It thins the rat's blood. He eats the grain. It thins his blood. He bumps into the furniture or something when he's running into his little hole, and he bleeds to death. That's how that rat poison works. Warfarin, coumadin, right? Yes? Okay. Very, very old drug, very, very cheap drug, right? And when you're on this, then you have to go maybe once a month and get your blood checked, and they see your how long it takes to clot and such, and so that way they'll know to adjust your dose up or adjust your dose down. Because if you're on too much and you're in an accident, have you ever seen the old people with the bruises all over their arm? Yeah, they're probably on that. Now, there's a new one where you don't have to do that, Xarelto or something like that. Yeah, and you don't have to go get your blood checked ever so often, but it's got some scary side effects. And I have one patient that's on it, and he loves it because he don't have to go to the hospital every month and get blood drawn and all that stuff. But anyway, so yes. And again, they'll shoot heparin through that IV tubing to make sure it doesn't clog up and to make sure that to clean it out. Yes. Okay. I already talked about that thrombocytopenia. Yes. Okay. Now let's talk about blood loss. Right? If you lose 15 to 30% of your blood, you're going to get pallor and weakness. Pallor means what? It means you're peaked. It means you're white, right? Pallor. Yes? Pallor and weakness. Yes? Right? If you lose over 30%, you'll go into shock, right? And you can lose your life. Okay? Blood transfusions, right? So you got to get the right blood type and RH factor, yes? And sometimes, if it's a trauma, like in war, somebody gets shot and they're spurting blood, right? They're going to give them whole blood. But other times, when they didn't lose necessarily their volume, but they got in trouble with the red blood cells, maybe they'll give them packed cells, just the RBCs. Yes, ma'am?
What's the word next to power?
Weakness, power and weakness. That's quite all right. Okay? Again, sometimes they're going to get packed cells, just the RBCs, but sometimes they're going to get whole blood. Yes? The shelf life of blood at 4 degrees Celsius is 35 days, okay? You don't have to write that down. But anyway, that's why they're always having blood drives, right? Because it only lasts for about 35 days in the fridge. Yes? And after that, they got to throw it out. Okay? So that's why they're constantly having blood drives going from here, going from there, and this and that, right? Yes? Okay, we already talked about that. We already talked about that. Okay. Right, transfusion reactions, real quickly, almost done. Transfusion reactions, right? Transfusion reactions, yes? Fever, chills, nausea, vomiting, right? Our book says general toxicity, whatever that means. It means you're sick as a dog, is what it means. But anyway, right? And again, if they give you the wrong type of blood, and again, it can clog up your kidneys so you can go into kidney failure. So that's why they're going to crank up the IVs. They're going to start an IV and they're going to run a gallon of fluid in you every day just to try and keep those kidneys from getting clogged up, right? Yes? Okay. Now, one other thing I want to mention. Autologous, A-U-T-O-L-O-G-O-U-S, transfusion. What in the heck is that? Okay, autologous transfusion. What that means is this, okay? Years ago, AIDS came out. We didn't know what it was. We didn't know how to test for it in the blood. And people would go in the hospital and have a surgery and come down with AIDS later because the blood wasn't checked because they didn't know how to check it, okay? So at that time, it became very popular to do an auto means self, right? Autologous transfusion. What that means is this. Okay, I'm going to have my knee replaced, right? I'm going to have my knee replaced in 2 months. I go in and they draw out some of my blood and they freeze it. And then a month later, I go back and they draw out another pint of my blood and they freeze it, right? And when that surgeon does knee surgery, which is a bloody surgery, by the way, because they're hammer and chisel and all on your bone, right? Yes, it's a bloody surgery. And bones have a major blood supply to them, okay? That's why they'll heal up in 6 to 8 weeks when we're young, right? But anyway, okay? And so they give me my own blood because I donated my own blood, so I'm not going to get AIDS or some other crazy disease because of bad blood, right? Now they check it and they, do all that. And also, too, when they give blood, they always, years ago, they wanted to know, where have you been? Well, where in Europe have you been? Well, where did you go in South America? Well, what year was that, Because they want to know if I got any diseases from around the world or stuff. But anyway, so now I just don't say anything about my travels, right? Because I have no blood diseases. But anyway, okay, autologous, right? I'm going to write that one down, by the way, folks. Okay, but anyway, yes, autologous, right? Give your own blood, and then when you have surgery, they give it back to you. Okay? Yes, because they know, oh well, she's going to have knee surgery, so it's a bloody surgery. Then they have to give me some blood back. Yes. Yes. Now, I have some friends, they're witnesses, they believe in not taking blood transfusion, right? Because you're not supposed to, in the Old Testament, don't drink blood, blah, 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 this and that. But anyway, and so they don't take blood transfusion. So that's a religious thing. So, yes, got to respect them. That's the way they feel about it. Yes? Okay. If you haven't figured out, I like blood. Blood's cool. Blood's very interesting. Yes? Right? We learn a lot of things about health through the blood. Yes? So, okay. See y'all tomorrow. And like I said, probably Wednesday. If you possibly can, be here on Wednesday, because I think that's when we'll do the blood typing. Yes?
Thank you.